Hi, I'm Dr. Chris Theagaraja from Park Avenue Oculoplastic Surgeons in Denver, Colorado. I'm an oculoplastic surgeon specialist. I perform surgery on the eyelids, tear duct, and eye socket. Today I'm here to discuss the risks of blepharoplasty or cosmetic eyelid surgery. What are the risks of blepharoplasty or cosmetic eyelid surgery? Well, first off, there are risks for blepharoplasty that are associated with performing any surgery. Second, there are risks associated with surgery that's performed around the eyes. And third, there are specific risks that are applied towards blepharoplasty surgery. So first off, like any surgery, like hip surgery, cataract surgery, or knee surgery, blepharoplasty is a regular surgery, and with it, like any surgery, there are the risks of bleeding, scarring, infection, and the need for more surgery. Bleeding. So, first off, the face and eyelids have a great blood supply. During surgery, we have instruments that control the bleeding. However, after surgery, there is a risk of bleeding. There can be excessive bleeding after blepharoplasty surgery, rarely, that causes vision loss or blindness. This is when bleeding or blood tracks behind the eye and puts pressure on the nerve of the eye. We educate patients to alert us as soon as they see any excessive bleeding so that we can potentially release that bleeding or stop that bleeding. Scarring. Whenever we make incisions for blepharoplasty, we try to hide them in the eyelid crease or underneath the eyelashes. Despite that, sometimes the incisions can be visible. Usually we have to, in this case, revise the incision to make it less visible or camouflage it in the eyelid creases themselves. Infection. The good news is, infection after blepharoplasty or cosmetic eyelid surgery is extremely rare. We have patients, however, use antibiotic ointment after the procedure in their eyes and on the stitches to help reduce the chance of infection. The need for more surgery. So anytime we do any surgery, there can be a need for further surgery, be it that the first surgery needs a further revision or more needs to be done, or that there is a complication that needs fixing. Secondly, there are some risks that are associated with any surgery that's done on the eyelids itself that's near the eye. Those risks are vision loss and double vision. So vision loss. Whenever we do surgery around the eyes, there's a risk of blindness. And this is really through excessive bleeding behind the eye. I spoke about it earlier where that vision loss causes pressure on the optic nerve, and that optic nerve can get compressed and get damaged and cause blindness. This is called a retrobulbar hemorrhage. Fortunately, this risk is relatively uncommon, but I educate patients about the risk along with what to do if they think they're having this hemorrhage to see me immediately. You usually have a very short period of time to release the bleeding. Second, there's a risk of double vision. During a blepharoplasty, we remove fat and skin on the eyelids to improve its appearance, but those happen to be near the muscles of the eye. Those muscles are used to control the eye to move up, down, left, and right. If there's inadvertent damage to the muscles, that can cause double vision. The good news is this is even rarer than having a retrobulbar hemorrhage or bleeding, but it is an important risk to know. Finally, there are some risks associated with blepharoplasty itself. The biggest risk really of the procedure is asymmetry. Everyone has some difference between both their eyelids, even before the surgery. After the surgery, though we try to correct as much asymmetry as possible, they can have still some asymmetry itself. If there is a significant amount, we will try to fix it. However, if there are small differences, we tend to leave it alone. This asymmetry is a known risk and probably the biggest risk of the procedure. It's very hard, if not impossible, to get one's eyelids exactly symmetrical after the procedure itself. Additionally, another risk of blepharoplasty is dry eyes. By removing skin, we can open the space between the eyelids to a certain degree. When that happens, the eyes can be a little bit dry, or the patient may have trouble closing the eyes. Usually, trouble closing the eyes resolves within a month, and the dryness usually resolves within a month or so. However, some patients may have an extended period of time with trouble closing their eyes, or even with just dryness itself, even if they can close their eyes. They will have to use artificial teardrops or may need further procedures to help them with their dry eyes. Finally, an important thing to know is there's a small percentage of patients after blepharoplasty that don't like the appearance or the change. They like their old eyelids the way they were. This new change can bring upon depression or sadness, and they may regret having the surgery. It's important to be aware of this risk. Unfortunately, it's hard to predict if exactly you will be someone who wishes you had your old eyelids after you've done your new surgery. The key thing is to have a frank discussion with your surgeon to know, hey, what can I expect from this surgery? And also to discuss, do you want to have a conservative or more aggressive approach? How much fat do you want removed? How tight do you want your eyelids? This gives your oculoplastic surgeon the opportunity to deliver the closest thing possible to what you were looking for. As a result, it'll make you a happier patient. Well, I hope this was educational, going over the risks of cosmetic eyelid surgery or blepharoplasty. As an oculoplastic surgeon in Denver, this is something that I commonly discuss with patients before surgery. It's very important to have an educated patient because they tend to be a happier patient. I'm Dr. Thiagaraja. Thank you very much.